So let's talk about pain management and medical marijuana. Lisa, let's talk about today's agenda. I know that in many cases, what we like to do is we want to talk about what the problem is. So we're going to talk about what pain is. And then what we're going to do is talk about how you can manage daily, you can manage your pain using medical cannabis. And we'll talk about exactly how to do that and how it works. Take patient experiences using medical marijuana and chronic pain. We're going to talk about dosing and which products to choose, and from a medical marijuana dispensary. So I think that's a pretty good subjects for today's video.
I think so too.
There you go. Yeah. So let's jump into what is pain. I know that chronic pain is one of the nation's top conditions for long-term disability in the United States. And in many cases, it's persistent. In other words, it's something that is constant, people have constantly. And we've also had a situation where chronic pain has been misdiagnosed and mistreated for many, many years, primarily because doctors began to realize that chronic pain is more than one condition causing the pain. So this pain is coming from two different sources, not one. And it's been difficult for doctors to be able to diagnose both of those conditions, if much less being able to diagnose one of them. So it's been something that a lot of people with chronic pain have had some difficulties being able to get relief from their doctors on that. But let's talk a little bit about what pain is. I know that pain is really something that comes with a combination of things. Pain can come from sensations, it can come from emotions, physiological factors, whether it's been trauma, anxiety, fear, overwhelming stress. And when we talk about psychological responses, we're talking about changes in your muscle activity, your heart rate, your blood pressure, and sweating. Now, we've seen that in many cases. And I think at Insa, you've seen a number of people that have come in to be able to help with pain. Is that correct?
We have. It's definitely the most common thing that we'll see patients and even recreational customers in Massachusetts will come in and look for something to help them with pain. It's definitely the most common thing we see.
And I think that one of the things that's interesting is, although we have pain and we worry about it, there's something called the fight, flight, or freeze. Pain is not necessarily bad. Pain lets you know that there's a problem that we should be addressed. But in many cases, it has something that has to do with not only the physiological response, but also can have a mental response that puts people into a situation where they're very, 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 very concerned about that. So let's jump down a little bit. Acute pain is something that will last more than a few months. Acute pain is when you hurt your finger, break a leg, do something like that. And it's something that is going to be there for a while. And it's something that is, I should say, in many cases, pretty easy to diagnose by doctors. But chronic pain is something, I should say, is something that's going to be there for much longer than a couple months. It's something that's going to be regularly occurs. It lasts for three or more months. I know that in my particular case, I have a couple of pain sources, one from pain, and I have literally in my neck from herniated discs, and then also from a left knee and a right knee replacement. And it's something that doesn't go away after 2 or 3 months. It's something that's there. You've seen a lot of chronic patients as well as acute patients at Insa, haven't you?
Oh, absolutely. You know, there are people who come in and, you know, if they're suffering from acute pain, a lot of the times it's something like, oh, I just, went for a really long hike and now my knees are sore. If it's something like chronic pain, that's more so like, oh, I broke my back a few years ago and it's just never been the same since. And we see both kinds of patients and customers come in through Insa.
Sure. Now, when you're talking about medical marijuana, I know that medical marijuana has been clinically effective for a number of different cases, not only chronic pain, but the pain that's related to ALS, epilepsy, PTS, anxiety, muscle cramps, insomnia. Pain diagnosis or shows up in a lot of different sources. In most states that have medical marijuana programs, it is one of the conditions that is a qualifying condition. But I think it's also important to point out that medical cannabis has been very safe. No one has ever died from the use of medical marijuana, and you can't overdose from it. Now, you can get high, you can get anxious, you can potentially lose your balance, but you're not going to die. That's the important part about that. And I think that's something that's very, very important. I think having a product that is not going to cause a fatality like you find with opioids and that type of thing, I think is fairly important. And we've seen also patients use medical cannabis to get off of opioids. You've seen that in your dispensaries, haven't you?
Oh, yes, definitely. We've seen some really special, stories of success of people trying to, get off of those opioids. Because eventually what they find is that they're taking the medication not so much to treat their chronic pain, but to help prevent withdrawal symptoms.
Mhm.
And when you get to that point where you're just taking a medication to avoid the negative side effects that come with it, there has to be a change. Something has to give. And we've seen those people come in and find some really amazing success from using cannabis.
Yeah, I mean, cannabis is something where it's an exit drug, not an entrance drug. And I think that's something that's been well proven. Unfortunately, we have a lot of politics and that's not following that. But from the standpoint of what the science is, it kind of shows that it really helps people get off of pain medications. Now, how does it compare to the pharma drugs? Well, first of all, there's a lower chance of addiction. I think that's really, really important. What's interesting is that when you take a look at chronic pain, in many cases in the medical cannabis use, 62% of patients use medical cannabis for pain. And that's been found by a study that was done by US pharmacists. And that's really a high ratio. I find that as something where people have really headed in that direction for help. And I find that very, very interesting. And that a lot of it has to do with because of the low risk of addiction, and also because of no fatalities. And also, when you're using medical cannabis, you're avoiding something that you find with the pharma drugs. With the pharma drugs, you have evidence of kidney damage, GI tracts, and long-term use of these particular products. You don't have any of that with medical cannabis. So you're not damaging your body. For example, there's no issue with liver damage. I think we found it to be a much healthier solution. Is that correct?
Yeah, absolutely. And one thing that, drives people to try cannabis is that the side effects are so much more tolerable. For other pain medication that's on the market, there's some really unpleasant side effects that can come along with it. And when it comes to cannabis, the side effects that come along with it is you might feel some elevation euphoria, that high. You might get the munchies, but overall, those are side effects that are much easier to tolerate than, serious depression or really bad diarrhea or, the small print that they put at the end of those commercials goes on and on with the negative side effects that can come along with it.
Or even death.
Yes, yes.
That's what's important. That's what's really important to understand. So, and where do we find out this? Well, we find out that although here in the United States, research into medical cannabis is really just beginning, because about 2 months ago, federal government passed legislation to allow this. But being a Schedule I drug here in the United States, there's been really no research. However, people like the University of California can do what they call anecdotal research. In other words, they can go out and find people that are using cannabis, for example, in this case, for neuropathic pain, and do a study to find out if it has in fact helped them. And that's when they've actually put that study together, and it showed that it in fact did help people with neuropathic pain. McGill University, because they're in Canada, is able to do a complete study, just like we're used to with double blinds and that type of thing. And what they found is that it helps relieve pain, it helps with sleep quality, it helps with the anxiety that patients have. And so it's something that's been extremely effective. And one interesting point is in a study of 2019, 80% of the participants found that medical cannabis was extremely useful. So science is really on the side of cannabis. And although it's not being studied here in the United States, it has been very actively studied around the world. And if we go to our own source of information, PubMed, which is where the doctors find all their research material, you'll find a lot of studies on medical cannabis, and you'll find a lot of studies on pain management that are out there. This is some of the studies that you'll see. And I'm not going to go through a whole bunch of, there's a lot more than just this. But what I wanted to show by this slide is there's been a long history of studying medical cannabis and pain that's been going on for a lot of times. Now, what's interesting is if you look at all the authors that are out here, all these authors and all these sources, they really are from foreign countries. They're not done here in the United States. They've been done outside the United States, and they're very effective in certain cases. Now, one interesting side note is a gentleman named Sanjay Gupta, who's known in CNN for being their medical advisor, is someone that has actually put together some videos on what he called Weed, was the name of his program. And here's a commentary that Sanjay Gupta has put together for medical cannabis.
THC, which is the psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive chemical. We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
With opiates, you're talking about killing the pain, masking the pain, you're done.
Dr. Julie Holland edited the Pot Book, a complete guide to cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. But cannabis works on two receptors, one that blocks that pain and one that decreases inflammation. It's ironic that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, two plants, the natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies. But that all changed in the 1930s. Opioids would go on to become a best-selling drug, and cannabis became increasingly fringe. In part because one kind of cannabis, called hemp, was a threat to big business. Hemp is a cheap fiber, good for making paper and canvas. It's more absorbent than cotton and could be used as a potential fuel.
So there were a lot of vested interests that sort of put cannabis down, took it away from the doctors, made it illegal.
Lisa, when you look at this, that we really didn't follow the science back then, and we're really just only beginning to follow the science right now with respect to providing pain management tools for folks that are suffering from chronic pain and other conditions.
Yeah, we're catching up right now, but it's happening pretty rapidly. It seems like there's a new state legalizing cannabis every day.
Mm-hmm. What's fascinating is that I've been doing, on my side, I follow the research quite a bit, and more research has been done in the medical cannabis literally in the last 18 months than has been done in all the months prior to cannabis being available. In other words, there's a lot of interest, a lot of research being going on, and we're going to find out over the next couple of years some really fascinating things. Now, why or what's going on? Well, we know, why is cannabis such a big deal? Why cannabis? Well, we know about our nervous system for a long time. When I grew up, everybody talked about the nervous system, and candidly, the Western medicine folks study the nervous system quite a bit. And I look at the nervous system as being something, what I call the cell phone system of our body. If we have a problem in one part of our body, we have a problem with my finger, it tells my brain, hey, Houston, we have a problem. And that travels through electrical pulses in our body through our nervous system to be able to say we have a problem that's out there. What I found amazing is that they never studied what Houston did with that problem. When the brain had that recognition, what did they do? And scientists were burning a lot of time and energy trying to figure out what they did until we started funding research. By the way, the United States government started funding research into medical cannabis in 1964, which your tax money and my tax money has and is currently doing. But we did it in Israel with Dr. Raphael Mechoulam. And what did he find out? He found out that there's an endocannabinoid system. And that endocannabinoid system is really critical. This is the part of our system that controls pain, anxiety, our memory, our anti-inflammation, and our immune system. This is a really critical system that really, when you say, Houston, we have a problem, your body hands that problem to your endocannabinoid system, and then your endocannabinoid system goes out and takes care of it. What they found out was that cannabis is a whole medicine cabinet. It has over 400 medical properties. It has 120 cannabinoids and over 100 terpenes. We have not had anything that powerful with respect to being medicine that we have found. Cannabis is a plant that acts as a medicine. It is not a drug. And what's interesting about it is when the cannabinoids you see over here, there's various cannabinoids that are out there, the CB1, the CB2s, the THCs. Let me back up here. Let me back up here for a second. Right here, you see the different cannabinoids that are out there. Then they work together. They actually provide one and one becomes almost three. So there's pain management capabilities or pain relief capabilities with CBD and with THC. Putting them together, one and one is three because they actually play off of each other. And on the right-hand side, you see a little person over here, this particular person is actually showing the various studies that were done. That's actually a report that was put out by Normal years ago.
Yeah, I read
How
a
does it
study
work?
not too long ago that was basically stating that, yes, CBD has some very well documented anti-inflammatory properties, which is one reason why it's such an effective medicine. But they said that those anti-inflammatory properties are even more pronounced and more effective when it is paired with THC.
Yeah, that's a
And
very
so
good point.
that's a
Yeah.
perfect example right there of that entourage effect.
Yeah, that's a very good point. What's interesting is our bodies produce endocannabinoids in order to be able to basically manage itself, as we mentioned, with pain, your emotions and things like that. And what they found, and this is what Mershulin has shown, is that phytocannabinoids or cannabis identically match the phytocannabinoids identically match the endocannabinoids in our body. And so by being able to take cannabis, what you're doing is you're putting into your body the material it needs to be able to fight whatever condition that you're trying to address at that particular point in time. In our particular case, we're talking about pain, and that's really, really interesting. And it's an entourage effect. What is an entourage effect? Within the cannabis plant itself, there are cannabinoids. We've heard about those CB1, CB2, THCA, CBDA, those types of things. But also there's terpenes. Terpenes are the part of the plant that actually protect the plant while it's growing, protects it from bugs and from animals and from disease. And also there's flavonoids. And when you put the three of those together, that's really the medicinal properties of cannabis itself. And here's some examples you can see here. I know CBD, for example, lessens the psychotropic effect, the psychoactive effect of THC. Is that right, Lisa?
It definitely does. You know, we tell people if you are trying a new product and you're maybe feeling a little bit too much inside your head, feeling a little uncomfortable, if you have something that's really high in CBD or maybe even just straight CBD, it's going to help, you know, make those uncomfortable feelings a lot less. You know, you're going to start to feel a little bit more clear-headed if you pair that THC with some CBD.
Sure. And that's where both of them working together really help you with the medical benefits that are there. Now, let's talk about Delta-9. Let's talk about THC. Because in many cases, THC has been really vilified as something that's something to worry about. Yeah, it does have psychoactive effects, but if you don't take a lot of it, in other words, if you can take the controlled amount of it, it does not only help to block the pain signals, but it helps with a lot of other conditions, like glaucoma, pain, anxiety, PTS, seizures, appetite, things like that. There's other things, for example, like weight management and diabetes that it helps with. Is that correct?
Yeah, absolutely. You know, there are all of these receptors that are living in our bodies. And when the cannabinoids like THC connect with them, that's when some pretty amazing things can happen and our bodies can start to regulate itself even more efficiently. And so, you know, that signal that's telling your brain, hey, I'm full, can get to your brain a whole lot quicker with cannabis sometimes. And that's where that weight management piece comes in.
Right. Now, I think the important part is you are in control. In other words, you don't have, we're going to talk about dosing in a little bit. If you take just a little bit of it, then you're going to be able to control if you're getting high or not. And also by doing dosing, we're able to find out by using it, both the THC and the CBD together. The CBD will actually lessen the psychotropic and psychoactive effects of THC. So there are ways of being able to manage it to make it a very effective medicine. And that's what really medical marijuana is all about. The recreational marijuana is I call it the recreational marijuana is like the 151 Bacardi of our particular industry. But in our particular case, we're really using it, as I say, quote unquote, for medicinal purposes. Now, what's interesting is the CB1 and CB2 receptors are really affected by THC and CBD. And we know that. We've known that for a number of years. But what they found out in the last 2 years is that there's a couple of other receptors that CBD does affect. One of them specifically is this VR1 receptor down over here. And this VR1 receptor is something, let me go back over here. This VR1 receptor is one where it actually controls not only our body temperature, but also our pain. So we have found that CBD is in essence like a super vitamin. And it's also helped with a number of other things, right, Lisa?
Yeah, CBD kind of plays nice with everyone. You know, there's a lot of parts of your body that gets real happy when it sees CBD coming around. And so, yeah.
And you mentioned something that was really critical, and that is that CBD affects what they call the A2A receptor. That's inflammation. If you reduce the amount of inflammation in your body, you reduce the amount of pain. There's a lot of people that'll say, I took CBD and my pain went away. And what's interesting is CBD is not really great by itself with pain. It really needs some THC to be able to do that. But if CBD does reduce the inflammation, it will reduce the pain. And a lot of people have seen that in their use of it. Here's a little chart. I know people have said, well, how do we know it does that? Well, here's the CBD receptors here's the CBD cannabinoids that match up to the different receptors that are there and the functions that they have. And I'm not going to run through that. We're going to leave this, as we mentioned earlier, you'll get a copy of these slides. You can actually follow that up. But there is evidence, scientific evidence, of where CBD has really helped with a lot of different receptors that are out there. And again, I'm going to point out, if we take a look at the TRPV1, TRPA1, those are the ones for heat and pain, and it really helps quite a bit in helping with that particular condition. So what's happened in the last couple of years is that we have discovered not only more information about cannabinoids, but we're also learning quite a bit more about terpenes and flavonoids. And what's interesting is in the past, we were talking a lot in the cannabis world about either indica and sativa. This was about 10 years ago. And then we got into this different strains and everybody said, use this strain or use that strain. What's interesting is that the property of cannabis that makes it, that really helps with the medical side of it are the terpenes. And the terpenes are, I call them the GPS. They're the of cannabis. They are the ones that help you guide yourself into the appropriate healing or relief that you're looking for cannabis. And so what's interesting is now we're referring to cannabis types as chemobars or chemotypes, which talks about what we call the chemical fingerprint. In other words, what does this particular product, what's it designed to do? And you've seen that at Insa, haven't you, Lisa?
Yeah, and so, you know, a lot of people who have even a little bit of experience with cannabis may have noticed that one flower will make them really energized and another one will maybe make them really relaxed and, you know, feel very at home on the couch. And it's those different personalities, as I like to call them, those different personalities are dictated by the terpene content. So those different terpenes, you know, come together to make one kind of experience, and then they can come together to make a very different kind of experience. And if you're looking for, you know, that really energized or really relaxed sort of sensation, knowing the terpenes you should be looking for is a really great tool in your tool belt.
Yeah, I think that's very, very wise. And then also, of course, we'll talk about a little bit later. We'll talk about dosing. You want to know what your sweet spot is. How much do I take to get the best possible relief without getting the negative side effects of maybe anxiety or getting high or something like that? So that's where we'll be talking about that. But that's the whole idea of using medical cannabis versus recreational cannabis. And if we take a look at how cannabis can help you, there's really CBD, Delta-8, and Delta-9 that addresses pain. Now, CBD is found in the hemp plant. It's also found in marijuana. It's not psychoactive. And we talked earlier about the fact it has a number of really good properties for the body to help in a lot of different ways. Delta-9 is found primarily in marijuana, although it is found in hemp. But the definition of hemp is a product that has 0.3% or less of THC in it. So it can be psychoactive, but also it triggers a lot of different properties that help with a lot of different situations, especially when it comes to things like PTS, spinal injuries, things like that, and also for pain. You need some Delta-9 in there to be able to help you be able to address that particular situation. Now, there's been a lot of discussion about Delta-8, and Delta-8 is very much like Delta-9. It is a different cannabinoid, however, and it's actually found in very low concentrations in marijuana, and primarily it's been produced as a byproduct of hemp. It does have psychoactive effects to it, although you have to drink about half the bottle to be able to get there because it has the lower tolerance that's there. Lisa, let's go to this next slide. You look at the difference between Delta-8 and Delta-9. There really isn't much of a difference except for the fact that Delta-8 doesn't have as much assistance with pain relief as Delta-9. Is that correct?
Yeah, it's a little bit weaker in that way. It's not quite as powerful as that Delta 9. The way that it works with the body sort of just hangs on to that Delta 9 THC longer and a little bit more effectively than the Delta 8.
Right. And what's interesting is it does have a lot of different, so with Delta 8, like I say, there's been a lot of discussion about it. It helps with, it helps with a lot of different conditions. It helps with your stomach, pain, relief, sleep, a lot of the neuroprotective properties for your brain, for example, and helps you relax. The biggest problem that you deal with Delta 8 is because it's an unregulated industry, a lot of Delta 8 products are made really by vendors that aren't testing the product. And that's what the real concern is. You really got to look at the COA, the Certificate of Analysis, to make sure you are getting a quality product that has been tested. And I know a lot of states are now banning Delta 8 because of the fact that they haven't had the proper tests that have been done for the products. And I think you've seen that in your state. Is that correct, Lisa?
Yeah, recently Massachusetts put a hold on Delta 8 sales just for that reason, because, we have a recreational and medicinal cannabis industry up here, and the regulation is one thing that keeps it going and keeps it going safely. And so by making it so that Delta 8 is going to have to be regulated just as strictly, it makes everything a little bit more above board.
Right. But I think also it makes it so it's a consumer protection. I don't think that they're trying to stop products as well as much as making sure that the products you're getting, even in recreational approved markets, you're still getting products that have to be tested and have a quality standard that's higher than what you'd find, what I call, on the street. So let's switch to my favorite topic, terpenes. We mentioned earlier that terpenes are the property of cannabis that really help with the relief that you're looking for example, with pain or of inflammation or whatever that's out there. I should point out, you look down here, terpenes they're what they call fat-loving compounds. They are found in the plant because what they do is they protect the plant from fungus, insects, pests, and large grazing animals. So that's what they're there for. But when the product is processed, we can actually produce and extract and identify the terpenes that are there. And there's over 100 of them that are being studied today. But these are the 6 main ones that are out there. Lisa, tell me about a couple of your favorites.
Let's see, a couple of my favorites. Well, I really love linalool. That's one of my favorites for sure. Not only do I really like the sort of like floral aroma and taste that comes along with it, but it is very relaxing and has some really strong anti-inflammatory properties to it. In fact, one of those studies that you mentioned, there's a study right now looking into linalool's ability to reduce seizures, and that's just the terpene linalool. That's no cannabinoids involved. And so I find that really fascinating.
And linalool is really good for an anti-inflammation. In other words, by reducing the amount of inflammation in your body, as we mentioned earlier, it reduces the amount of pain. And linalool does a really good job of that.
It does. It's really, really good at that. Yeah. Another one that's really good with pain is myrcene. Myrcene is the same stuff that you find in mangoes. And so sometimes it has that like really sweet, almost a little earthy, piney kind of smell to it. And this has been, very reported by patients and customers to severely help them with their pain. I know I myself, whenever I am dealing with pain issues, I like to look for a strain that's really high in myrcene, and it usually cuts through that discomfort very, very well.
Right. And I think also that ties in with caryophyllene or beta caryophyllene or caryophyllene. It's really, really good for pain relief. It's an analgesic, not only for anti-inflammatory purposes, but also it helps with pain relief, helps with depression. And really it's something that when you put myrcene and caryophyllene and linalool together, you've got a pretty potent package to help with pain relief that's out there.
Yeah, that's a good trio for sure.
Yeah, and myrcene is found in most cannabis products that you purchase at the dispensaries. One of the other ones that I really like is pinene. Pinene, especially for pain relief and for inflammation, is really, really good. The biggest problem with pinene, though, you have to be careful, is it will really improve your short-term memory. That's the good news. The bad news is that if you have PTS, I don't recommend high concentrations of pinene because it may bring back some memories that you really don't want to conjure up. But it's something to take a look at, especially if you're looking at it from a pain management standpoint. And the old standby of limonene is always there. Is that right?
Yeah, well, that's certainly my favorite tasting terpene. And so, like your super lemon hazes and sour tangies, they tend to be really high in limonene. And not only are they good for sort of helping, the experience, because it's, very flavorful and tasty to ingest, but also it's a very happy terpene. It's very good for that mood elevation and that stress relief part. Because as it's been very well documented, if you're suffering from pain and especially chronic pain, over time, your, ability to get depressed is increased. And so having something that's going to make you feel a little bit happier because you're, in pain is a great, thing to have for sure.
Right. And I think it's not necessarily targeted for pain, but it really helps with a lot of the side effects of pain. But one of the other terpenes that I like for that is eucalyptol. Eucalyptol is great. Again, it's an analgesic. It really works great for pain relief as well as inflammation. And it also helps with your sinus infections and things like that. One of the interesting things about eucalyptol is it also helps with blood pressure, which is really, really important for a lot of people to be able to control their blood pressure, especially as you get older. But these are the main 6 terpenes that we find in cannabis, and you'll find in most cannabis products, you'll find at least myrcene and potentially caryophyllene, and then a variety of other products that are there. What's interesting though is terpenes have a temperature. They actually are very sensitive to temperature because as you heat the temperature up, you can actually burn off a lot of these terpenes. Do you want to talk about that a little bit, Lisa?
Yeah, and so basically when you are looking for something with a high terpene content, and that's the main reason why you're choosing that product, you want to be able to enjoy all those terpenes that come along with it. And so the best way to do that is really try to keep the heat as low as possible. Now, if you're combusting, if you're smoking, that's going to be almost impossible because you can't really control the temperature of a open flame. But if you're vaporizing, there's a lot of vaporizers out there and vaporizer batteries that will allow you to control the temperature settings. And so keep the temperature pretty much as low as you can on those units. And that's going to ensure that you're getting more of those terpenes into your system.
Yeah. And as we mentioned, if you take a joint and you light it, you take that flame that's 500 degrees or more, you're going to burn off most of the terpenes and most of the cannabinoids. But if you have a vape pen that has a temperature setting, and what I mean by that is when you take the button, you can click 5 times to turn it on and 5 times to turn it off. And sometimes you could click it 3 or 4 times, and you'll see the color of that particular button change from, let's say, blue, green, could be orange, it could be red. You want to really set it to, I set it most of mine to the medium heat, which is the blue or the green setting, depending on the pen that you have, because it gives you all the terpenes that I'm looking for to help me with my pain relief that's there. If it gets too hot, you'll start burning off some of those terpenes, and that's what you got to be careful of.
Yeah,
Sure.
and you can taste it too sometimes when it gets a little too hot. It doesn't have as clean a taste. It's just a taste a little gross. So you can tell that way too.
Yeah, and that's why I highly recommend if you want to smoke cannabis, I recommend vaping, not lighting up a joint, because then now you can be able to get terpenes involved, which is the medical properties, which is what you're looking for. Now, let's talk about terpenes that you'll find in cultivars for pain management. And these are the most popular ones that are out there. I'm not going to go through each one of them per se, but as you'll see, there's a lot of them that are THC dominant as well as CBD dominant. And I think that's really, really important because I know AC/DC is a very, very popular product for pain relief. Being CBD dominant, it's easier. I think it doesn't get you as high. But what's interesting is it really works very, very well for, especially for pain relief that's out there. Now, from Insa's standpoint, you actually make some very specific products for that. Is that correct?
Yeah, we try to make sure that we have a wide range of terpene profiles to make sure that, we're covering all of our bases. So if a patient finds that, humulene is really helping them for whatever reason, because everyone does respond uniquely and differently to cannabis. And so if they find that one thing is working for them, we want to be able to have it for them. And so here we can see myrcene is common in there because myrcene is the most common terpene terpene and cannabis, but we also have some, caryophyllene, some linalool in there. And so we try to have a really good range so that patients have good options.
Sure. And you walk in, I think when you go into any dispensaries, tell them you're looking for a product that has the terpenes that are best for pain relief. And I think they'll be able to guide you to the products that they have and the best way to consume them.
Absolutely, they will. Terpene training is a huge part of what we do.
All right. Now, let's talk about routes of administration, because how do people take it? What's the best way to take it? I always like to start with the sublinguals. Sublinguals are where you take an eyedropper, put some of the liquid underneath your tongue. What happens there is the blood vessels, they're absorbed by the blood vessels in the inside of your mouth, and it gets directly into your bloodstream. And that's probably one of the most common and the best way to start for cannabis. It takes about 15 to 30 minutes for it to work, and it'll last between 4 to 6 hours. And I think this is the way a lot of people start. And this is the way a lot of people will also kind of figure out what their tolerance is to cannabis. But there's also other products that are out there. I know one of them is topicals. And I know you're just here in Florida, you're bringing your topicals in the market, although you've had it in Massachusetts and Pennsylvania for a while. Tell us a little bit about topicals, Lisa.
Topicals are great, and I believe they have just been released. So check out our menus and see our topical offerings. We've got some lotions and salves for you. So we're happy that they're finally out on the market. And so topicals, what they do is they can target the area of discomfort. And so I'll use my mother as an example, because I love talking about her when I talk topicals. So my mom really is afraid of all intoxicants. She'll have like one pina colada every 8 years, and that's it. That's her limit. And she had knee surgery a few years ago. And I was telling her, you have to try our lotion. People have said that they've gotten some really amazing pain relief from it. And she was very hesitant to try it. And finally, I just brought it, popped it on her knee, and within 10 minutes, she was, rotating her ankle and stretching out her leg. And she had gotten some really amazing relief from that product with no high. And that's the big thing, is that if you're looking for something that's going to give you the benefits of THC without the inebriation or elevation that comes along with it, a topical is going to be an awesome option, because the way your body processes it, you're not going to get high from it.
Yeah, and it works almost immediately. And then when you apply the topical itself, it'll last anywhere between 2 to 6 hours. I know there are patches that'll last longer than that, can go up to 72 hours. But the topical creams typically go between 2 to 6 hours. Is that correct?
Yeah, and what's nice is that since there is no inebriation that comes along with it, you can just reapply that lotion whenever you need to.
Sure. Now let's get into one of the other interesting products, which is what we call the oral parts, which are the capsules and the edibles. Now, you at Insa do a great job of offering some very, very tasty and some very, very yummy edibles, which I'll let you describe in a minute. But what you got to do with edibles is you got to be very, very careful. I know a lot of people talk about, well, I'll just grab an edible. That's true. But edibles take anywhere between 30 minutes to 2 hours to work. And sometimes they take an hour to 2 hours to work. What you've got to be careful of is about the time you think they're not working and you take another one is about the time they start working. So be very, very careful. Give it time. Just be cool. Just give it some time to work. But they'll last between 4 to 10 hours. So in my particular case, I'm a chocoholic, and I'll take some chocolate before bed at night, because what it does is it helps me through the entire night. Or if I take a sublingual or a topical or something like that, I'll wake up at 2 or 3 in the morning and I need to have another dose. This is something that will last through the night. A lot of people I know who've tried them have basically said, listen, I've been using that gummy or that chocolate before bed and I sleep through the night. Tell us a little about your edibles, especially your chocolates. I know you have some extremely tempting products that are out there.
Yeah, we have some real authentic European imported chocolate. That's what we use as a base for all of our chocolates. We have some really amazing varieties down in Florida. I'm definitely jealous. We just released our cherry cream chocolate bar. We also have a lime mint, which is kind of like a play off of a mojito. A lot of really awesome chocolate options. And if you're more towards the fruit flavors, you're not quite a chocoholic like Marc and I, then we also have like those gummy drops, those fruit flavored drops for you as well.
They're very good. But again, edibles are great and they all have their place. Again, they'll last for 4 to 10 hours, but be very, very careful. give it time to work. Don't go taking, they say take a little square, one of the little small squares of the chocolate bar. Don't eat half that chocolate bar. It's not, you'll definitely feel it after about 2 hours. It's something to be very careful of. And the last one, of course, is called inhalation. We've talked a little bit about that, the vape pens and the concentrates. Let me go to this slide right here. Let's talk about this. Lisa, you have a number of different options if people want to smoke. A concentrate means you buy a pen that you actually put the concentrate into, and that usually gives you the capability to control the temperature, which I think is a great idea. Plus, you can also choose a lot of different types of products that are there. Tell us a little bit about that.
Yeah, we do. So like if you want to have your own concentrate vaporizer pen that you really love, come in, try some of our waxes or batters. We actually just released rosin, which is pretty much the highest terpene content product that you're going to be able to find. So if you really love that terpene content being as high as it can be, pick up one of our rosins using your concentrate vaporizer pen. And also our vaporizers are dart vaporizers. You can actually adjust the temperature settings on those batteries. And so if you want to keep it nice and low, you can do that as well on our Insa Dart batteries.
And I think that's a good point you made about the rosins. And also, I bought from you last week some resin pens for concentrates. You have them here in Florida. And what I'm trying to say is very high in terpene profile. I mean, I personally prefer rosins and resins when I get my hands on them because of the terpenes to help me with, in my particular case, pain relief and also to control inflammation.
And I can tell you that that's what our lab gets really excited when we have a product that gets really, really high terpene content. They get really, really excited about that.
Right. And you guys have done a great job of that. Now, there's always the old question of how much does it cost? And you guys have an amazing array of discounts. Tell me about that.
We do. We have the best reward program in the state. And so if you're a frequent shopper, come on in and you will actually get some money back from your purchases. More information on that on insa.com. And also there's everyday perks. And so if you're a veteran, you get 20% off. If you are qualifying for a compassion discount, you get 10% off. And we're constantly having new promotions. We're doing a food truck day this weekend, where if you come on in and purchase something from us, you get a free item from a food truck. And so, check out insa.com, sign up for our insiders, sign up to be one of our insiders, get emails and text messages of our newest promotions, and you'll learn about the coolest new thing that we're doing, because we're doing a lot for Florida. We want to make a big splash with you guys.
I highly recommend signing up for the newsletter, not only just from Insa, but for any dispensary that you're interested in, because they will give you those perks that are coming out. And I think I get 2 or 3 emails a week where you guys do some great perks and some great deals. If you want to be the cannabis whisperer, this is the best way to be to find out your best discounts.
Yes, for sure.
That's there. And also you mentioned your first, second, and third visits, you get discounts as well.
Yeah, so we want, people to come try us out, and we want them to be able to try an array of products. And
Right.
So by offering these first timer discounts, you can try a wide variety of products and not worry so much about your budget. We're giving you a little wiggle room to try some new things that you maybe haven't before.
The other thing you're really nice about Insa is you have a fairly interesting exchange policy. If the consumer buys the product, it really isn't working for them, you can take it back to Insa, and you really want to make sure that the people get products that'll help them from a relief standpoint. And you do exchange products to really get the quality standards that you need to be able to address the relief that the customer's really needing, right?
We do. So if you've been talking with, one of our associates and they really recommend something because they think it's going to be right at home, and for whatever reason it's maybe not working into your routine, or it's just not giving you the effects you're looking for, bring the product back, talk to a member of leadership, and we'll exchange it for you, and we'll try to find a product that does work better for you.
Yeah, I know, especially as a senior citizen, this is a nice feature, because some dispensaries don't do that, and I think this is important to point out that you do. That's my compliments to you.
Yeah, we know that a lot of dispensaries are all sales final, which we understand, but our main goal is to make our patients stay better. So that's one way we do it.
Now, dosing is really important. To find out what your sweet spot is really key. And it's very much like you mentioned, you were telling me earlier, Lisa, it's about like alcohol and caffeine. Tell me a little bit about dosing. How do I find my sweet spot?
Yeah, so just like some people, they have 1 cup of coffee and that's all they need all day. Some people need to have a couple shots of espresso to get their, way through their day. And so just like that with, every individual having their unique reaction, it's the same thing with cannabis. Some people might need just a little bit of chocolate in the morning and that'll take care of their pain as far as they need it. Some people like you may have a little bit more of a varied, routine. And so that's what's the nice thing about cannabis is that you can actually really, minusculely decide how you want to feel throughout the day. And there's a product that's going to fit those needs.
Right. And you really want to go low and go slow. Start with a very small amount of it. Try it for a day or two, find out if it works. I know, and you mentioned something earlier, and that's how long do I take it? How many times a day? In my case, I have herniated discs in my neck and I have had knee surgery. So what I really want to be able to do is I want to be able to have a product that'll last in the morning, it'll last in the middle of the afternoon, it'll last in the evening, and then candidly, I take something just before bed to help me in that particular situation. And that's what's important is find out what the coverage that you need for your particular set of products that are out there. I know that a lot of people just say, well, I took it and it didn't work. It worked in the morning, but it doesn't work in the afternoon. And that's because, remember, it has that 4 to 6 hours of relief that's in there that you got to pay attention to, right?
Absolutely. It's just like if you, think of like regular over-the-counter pain medication. If you have a headache first thing in the morning, you take an aspirin, you're probably going to have to take another aspirin in the evening to help with that headache.
Sure, that's really there. So we have a dosing webinar coming up at the end of March, and I would like to invite everybody to that. It'll really help to be able to figure out what your proper, we call therapeutic relief spot is. And I think this is probably one of the most important things about using cannabis. When you get it right, it works great. And just like alcohol and caffeine, you got to figure out what get it right is. And some people can take 1 drink, some people can drink the whole bottle. You got to figure out where your tolerance is and what works best for you. So I'm going to deviate for a second because we've covered a lot of our slides. I just want to invite people, if you do have a medical cannabis story, please go to igotmylifeback.com. We would like to find out what your stories are. And more importantly, if you're interested in how people are using cannabis and hear their stories, that's what this site's about. We would like to have people be able to really talk about their cannabis experience and let others learn about what it's all about. And so please feel free to visit that particular site. Lastly, I do want to point out, I know that Insa doesn't really sell CBD products, hemp-based CBD products. You're primarily marijuana-based. But if you're looking for a CBD product, as we mentioned when we were talking about, when we talk about dosing, you should have some CBD with you, because if you take the CBD, equal amounts of CBD to THC, what it'll do is it'll bring down any of the negative effects that you would get potentially from CBD, from THC. So we have a site called My Botanical Wellness. We created it, and it's really been driven by doctors who actually have looked at the products and say, here's the products that really work for you. And first-time patients get a 20% discount. And if you use the MMWW15 discount code for watching this webinar, it'll be able to get there. So Lisa, we have a couple of other seminars coming up. I know I'm going to do, we have cancer, chemotherapy, neuropathy coming up. We're going to do an in-person seminar at the Villages. But you and I are going to be doing anxiety and stress March 1st. Is that correct?
You sure are.
Yeah. And then we're going to be doing improving sleep, terpenes, and dosing, as I mentioned before. These are all of them are live seminars on a Wednesday night, except for the in-person seminar at the Villages. That'll be at 9:30 in the morning. And yes, on the 22nd of February, we're doing 2, one at 9:30 in the morning and one at 6 o'clock at night. So please feel free to join us and help in that particular regard. So the bottom line, I think what we've gone through a lot of information about cannabis really is you're in control. I think, Lisa, you pointed that out to me, and I think it's really important that with your cannabis experience, you're in control, right?
You are. You really are. You can really tailor the experience to fit your needs. And so if you find that your pain gets, really bad in the evening, you can find a product that's really going to help,
And also, you're not going to get addicted. One of the things about cannabis is that you can't get addicted from it. You can stop using it at any time. Now, the only negative side effect that I have found with cannabis is because I'm using it for herniated discs in my neck. If I stop using it for a day or two, which I do every once in a while, just to let my body reset, to let the endocannabinoids re-engage, after about a day and a half, my neck will tap my shoulder and say, you better do something pretty quick because the pain's coming back. I'm not addicted to cannabis. I'm addicted to getting rid of my pain. And there's a big difference between the two. I can stop at any point in time.
Yes.
Okay. And that's because I'm basically producing products that my body that my body actually produces itself. And then the entourage effect, that's always important. I think everybody should understand, really, it's a combination of the terpenes and the cannabinoids together that help with a lot of different things. I've had people who take it for example, for pain management, and they'll take it for arthritis, for example. What they'll find out is the pain in their shoulder goes away. Your body knows where your problem is, and it'll produce endocannabinoids to address that. So we've covered a lot of different topics. Why don't we kind of stop the video here and jump into some questions? How does that sound?
Sounds great. Love answering questions.
Okay. So Lisa, we covered a lot of information, and I think it's really important that we maybe answer some questions from people that have submitted some questions, as well as the webinar questions that are out there. There's a couple of them that I think are really interesting, and I'm going to hopefully get this name corrected. Adelorada White had a really good question. It says, how does it help rheumatoid arthritis with the joints or just pain? Which is good to have higher, THC or CBD? I was told by the dispensary I was told by my dispensary that is true, that I'm still trying to learn and to thank you. I will basically say the best thing for rheumatoid arthritis is a high regimen of CBD. And what I mean by that is you have a CBD product, it'll help with the inflammation quite a bit, and the THC will help with the pain, but you really need to be able to put the THC in the product to be able to get the relief that you need. I know if your dispensary is saying that you need a high THC product, I really disagree with that. I really think what you do is you need to have something that has higher in CBD and lower in THC. Lisa, your thoughts on that?
Yeah, I think that that's a really great place to start. You know, some people are going to respond more effectively to things that are high in CBD. Some people are going to respond more effectively to things that are high in THC. And so, you know, you may want to try that high high CBD product. And then if that doesn't work, eventually try things with a higher THC content. But I think that a high CBD content product, like a tincture or a vaporizer, is going to be a really great place to start.
Right. I know DE is asking a question. Dawn has asked a really good question, and that is, she doesn't like feeling high. She's using a high CBD and low THC product for her polyarthritis and severe degenerative discs, but she's finding it hard to keep her pain under control. Dawn, I can relate to that. I have the herniated discs in my neck, and I would love to use almost a very, very high concentration of CBD to get rid of it, but I have to put a higher concentration of THC in there. I think that if you are in a situation where you're trying to get rid of that pain, you may want to increase the amount of CBD that you're using. Now, here's what I recommend. Increase the amount of THC, but take less of it. What I'm saying that if you're taking, for example, if you're using tincture drops and you're taking a 0.025 milligrams, you may want to take 0.25 milligrams, cut that in half. But take a CBD product that's potentially, if you're high in CBD and low in THC, you might be doing an 8-to-1, might be doing 4-to-1, 1-to-1. You might go to a 2-to-1, and you might want to be able to, again, lower the amount that you're taking. You're going to have to increase, like it or not, in order to be able to get rid of that pain, you've got to increase the amount of THC. So you might go to just a little bit more THC, but also just cut the dosing in half initially and see how that works. That might help quite a bit. That's out there. Bill asked a great question, which you might be able to help with, Lisa. Can you use expired gummies?
Yeah, that's a really good question. And we do get that question sometimes.
Mm-hmm.
I would say that you can use them at your own risk, but the risk probably isn't all that great. As long as you have, kept them in a cool, dry place, the THC and the CBD that's in there is probably going to be fine. It's those additional ingredients that are a little trickier to, guess if they're going to be okay or not. So like the added sugars or fruits or whatever has been added to the gummies. And so I know a lot of people who have used expired gummies and they've been just fine. I would just say, just recognize the fact that they are expired, they are past their best by date, but they should be okay.
You should be okay to use them. I think what you're really dealing with is how effective they'll be. and you may have a problem with the efficacy of that particular product itself. Let's see. Oh, Lisa, the question about it says you're opening, it says about opening a place in Lake Placid. I think you're talking about Lake Placid, Florida, not Lake Placid, New York. Is that correct?
I am, and I'm in the same boat as you, where I didn't even realize there was a Lake Placid, Florida, until relatively recently. And so, yes. However, we are looking to expand into New York in the future. And so, while we're not going to be in Lake Placid, New York, we are looking to be in New York sometime soon, hopefully.
Right. Now, Charles asked a really good question. He says he's used CBD creams for relief, was hoping for more than an hour or two. Well, the nature of the beast, the topicals typically last between 2 to 4 hours. And so you're not going to really find a topical that's going to last longer than that. And again, it depends on your body and your tolerance. But I would say if you're looking at something where you're going to need to, like if you have arthritis, you're trying to deal with that particular issue, you may want to try a tincture drop, because that's going to help quite a bit. And again, understand they're designed to only last 2 to 4 hours, so that's what you're finding out. That's there. Okay. Lisa, you were asked a question about, can you order online? You can, but you have to still pick it up in the store, right?
Yes. And so that's a really great question. You know, if you are ordering in a state that has a dispensary, but you want it to get shipped to you, you aren't going to be able to get it mailed to you, but there are certain dispensaries that have delivery options. And so I know we have delivery options here in Florida, and we have delivery options in Salem, Massachusetts. Again, that's probably going to, if it's a delivery option, it's probably going to be, you're probably going to be out of the delivery range if you're that far away, but that is another option. Unfortunately, federal laws prohibit us from shipping cannabis through the mail. Otherwise, we'd totally be happy to do so.
Yeah, we still have to deal with I will call it the federal prohibition that should go away, but it's unfortunate we're dealing with that. Victoria asked a great question. She's noticed many bud tenders just don't know much about strains or cultivars. When you ask about terpenes, often it's hard to find out, and not all dispensaries and all bud tenders have enough notice of really have a good product information. This is a real problem in the industry. Terpenes are really the critical part to getting relief from cannabis. Although there is some training that the dispensaries do on terpenes, and I know Insa does a great job on that. The problem that the bud tenders have is that you're constantly bringing out new products all the time. And when you bring out new products, they'll have different terpene profiles. And to try to memorize the terpene profiles for 10 products is one thing, but to try to memorize the terpene profiles for 50 becomes a real problem. And I think that's just one of the things in the industry that's an issue that's out there. I can tell you that within a month or two, we will have a solution for that. Right now, I don't want to talk much about it, but I just want to let you know that that is a big industry issue, and it's something that's not uncommon that you'll find that's out there. You can find out what terpenes are in the product by looking for the COA, but you're not going to necessarily find bud tenders that really are knowledgeable. I'm defending them. It's just so hard to memorize all those products, especially with the new ones coming out. That's really a problem.
One thing that makes it a little easier for, Insa products is that we do put the top 3 terpenes that are in that product on the label. And so we are actually one of the dispensaries that does go and put that terpene information on the label for you. And we also have lots of training materials and resources for our team when it comes to terpenes, because we're fairly obsessed with them here at Insa. And so say you see a strain or cultivar online that you're interested in, you can give our customer support team a call at 1-877-500-INSA or chat with us live through our website. And they'll be able to look up the different strains in your area and see what the top terpene content is in there and help you out that way as well. So if you have a question on something that you're seeing online in terms of the terpene content, give our customer relations team a call, and they'll be able to help you out even further than what you can see online.
That's great. I know that one of the questions that Carolyn came up with is, do y'all make Delta 8 products? Well, the answer to your question, and I'm going to preempt this and then let you take this, Lisa, is yes. you do make Delta-8 products. In fact, almost all of the products that Insa puts out has a certain amount of Delta-8 in it. Now, do they make a Delta-8 specific product? I think the answer is probably no. Is that correct?
Yeah, that's correct. No.
Yeah, and I don't think you're going to find, I'm sorry, you're not going to find a dispensary that does, but go ahead.
It would be very rare. No, most cannabis dispensaries, they focus on that Delta-9. That's what we deal with the most, because when it comes to Delta-8 products, there has to be some sort of lab, assistance going on there. It's very difficult to grow flower that has really, really high concentrations of Delta-8 products. And so most of the time, those Delta-8 products that you see have been, converted from like a hemp CBD or something like that. And so we don't quite do that side of the industry. It's great if you're getting relief from those Delta-8 products, definitely continue to use those, but you're going to find more CBD and Delta-9 in Insa dispensaries.
Yeah, I think Delta-8 is something that, again, a lot of the products on the shelf are really isolates. And so I think a lot of the dispensaries stay away from that because they want to get the terpene profiles in there. You want to be able to provide relief. And Delta-9 works so much better than Delta-8. Why take the risk? Now, there's a rush to Delta-8 because there's this perception that you can get high off of it. And the answer to your question is you can, but you got to use an awful lot of it. It's better to just go with medical cannabis that's out there. I'm not against Delta-8. I just think that it's just because it's unregulated, it's a slippery slope. And I would probably stick with the dispensary approved products to be able to go into that. Robin's asked a question: what about tinctures and capsules that are out of date? I think it's the same kind of answer. You're not going to get, if you use them, they're not going to cause any negative side effects from the standpoint that you're not going to die from using it. They just may not be that effective, and that's really the issue that you're dealing with. That's safe to say, Lisa?
Say so, yeah. And again, those other additional ingredients is something you have to look out for. Like I know a lot of times tinctures and capsules, the base material will be like an MCT oil, like a coconut oil. And so you just want to be careful that that part of it hasn't gone bad. And if you're storing it in a cool, dark place, the cannabinoids really shouldn't be degrading all that much unless it's really severely out of date. But you should be okay.
All right. You asked when capsules will be released. I think, do you have capsules on the market? I think you have them, don't you?
Not yet, but we are looking to release them very soon.
Okay. I know you have them in Massachusetts, but I think in Florida is a real issue that's there, right?
Yeah, and we're actually, give you guys some insider information here. We are looking to formulate some fast-acting tablets and capsules soon. And so keep your eyes peeled for that.
Yeah. Okay, so Anonymous asked a question, can you direct me to some studies on EF? The answer is yes, I can, but what I like to be able to do is, if Anonymous, can you send me an email to event@marijuanaaware.com? Send me your email address, and I'll send you back some studies. There is some studies that have been done out of Israel, and there's one study that was done out of Germany that would probably be of interest to you. And I think what I'd like to do is be able to get you those studies, and it would take me a while to just dig them up online right now to answer that question. So if you can give me your email address, I know you want to remain, if you want to remain anonymous, I understand that, but I do think that we can get you some information if you send that to me, if that would help quite a bit. Let's see, what other do you have? Lee, I think we have some other questions. Is that correct? That were pre-canned? Yeah. Can medical cannabis use mask symptoms? I don't think they're necessarily masking symptoms. In many cases, what medical cannabis is doing is it's relieving that particular problem or that particular symptom, and it's really being able to address it. Now, what cannabis will do in the case of pain is it does mask the pain. In other words, it does reduce the amount of pain that's there. And so from that particular perspective, it does do that. But I don't see cannabis is really not like pharma drugs that really mask pain. What they do is they really address the particular symptom to be able to reduce the pain that's there. One of the other questions that comes up, at least I want you to help me with this, is can you take it as needed, or do you have to take it to be a routine? I take it as a routine. Your body needs to build up the endocannabinoids it uses endocannabinoids to manage your body. It needs to build up the phytocannabinoids to be able to have the resources it needs to do the job. So it's much like a multivitamin. I think it's something that you should really take on a daily basis. And your thoughts on that, Lisa?
Yeah, I honestly think that you can do both. Like if you have really severe pain, like you do, Mark, then having a routine in place is definitely a really smart idea. Because then you can know that you're covered, your pain is going to be reduced off the day. But if you have something, a different kind of symptom, like nausea, for example, that is something you could use cannabis for as needed. So if you're feeling really nauseated, because pain actually can cause nausea as well. So if you're feeling really nauseated, that's something you could do as needed and not necessarily something you need to build a routine for. But I do strongly recommend that if you have chronic pain, to start building that routine, start seeing what works for you in the morning, what works for you during the day, and what works for you at night. And it's going to definitely improve your relationship with cannabis.
Right. Now, we had a question about fibromyalgia treatments. What fibromyalgia treatment suggestions? Thank you. First of all, in 2 weeks, or 3 weeks, we're doing a webinar on neuropathy, of which we cover fibromyalgia in that particular webinar. So please tune in for that. I think the best way to address that particular issue is to understand you're going to need a THC and CBD product, both of those put together. And really, fibromyalgia is a case where your nerve endings they're exposed. And what THC does is it helps coat. It's a neuroprotectant that protects the nerves and really helps. It doesn't get rid of fibromyalgia, but what it does is it helps to lessen the effect and helps you be able to manage the pain associated with it. So I would say what treatment suggestions, again, the standard ones we use for cannabis, whatever dosing method you like, whether that's tinctures, smoking. Interesting enough, the topicals will work. Is that correct, Lisa?
Yeah, those are a good option, especially if you're feeling like that pain firing like in your hands or joint areas. Topicals are going to be a really great option as well. And edibles. Edibles tend to last a really nice long time too. So if you find you have a couple gummies or a couple of squares of chocolate, that's going to maybe last 4 to 6 hours during the day. So that might be a really great option for you as well.
One of the questions that comes up is, can medical cannabis correct problems with pain totally? And the answer is yes. I have 7 herniated discs in my neck. I have 2 herniated discs in my back. I've had left and right knee surgeries. I've had my right knee replaced twice. And that is a recipe for pain. And my pain level is less than a 1, sometimes even less than a 0.5 on a daily basis. But I use medical cannabis every day, except for every 6 to 8 weeks, I will take 1 day to a day and a half off. They recommend really taking 2 to 3 days off, but after about a day and a half, my neck taps my shoulder and says, if you don't do something, buddy, pretty quick, we're going to bring back some pain you're not going to enjoy. So I basically take about a day to a day and a half off of my routine. So the answer is yes, it can. And I can keep my pain level down below 1. Now, the other piece of magic to that is make sure you get your dosing correct. Find out what your tolerance is to THC, find your tolerance to CBD, and make sure you get that ratio that's correct. And also, once you find that, make sure that if you have pain is not going to go away during the day. In my case, I wish my herniated discs would go away, but they're not. So I've got to do something in the morning. I've got to do something midday. I've got to do something in the evenings. And now I do something for sleep. So it's a matter of making sure you have the coverage of the products that are really, really out there. And I think if you follow that regime, you'll make sure you get your dosing correct and your coverage, I think you'll be able to help you quite a bit. Now, the question is, how can I help with pain in my back and in my knees? I just think I just addressed that. That's exactly my issue. And I've been able to do that quite effectively. Now, I will tell you, one of the tricks that I use is when I wake up in the morning, I do take tincture drops. And that tincture drops takes about 20 to 30 minutes to work. And it'll last between 4 to 6 hours, depending on the drops that I take. I don't want to live in pain for 30 minutes. So I have on my nightstand, I have a vape pen. And 1 or 2 hits out of my vape pen. And literally within a minute or two, my pain goes down to less than 1. And I think that's really, really important to understand. So I mix and match the dosing routines or the routes of administration to really give me the coverage that I need. I get the vape pen right away to help me with my pain. And then I've got the tinctures to last. It'll take me until the early afternoon. And then I take another tincture drops after that. Or candidly, sometimes in the afternoon, I take a gummy. And then in the evenings, I'll take tincture drops and gummies as well, if not some chocolates before bed, right, Lisa? That's the
Yeah,
routine.
that's really common.
itself.
Yeah, that's
Yeah.
really common to have, different products for different times of day.
Mhm.
It's rare to find one single product that's going to cover all times and all symptoms. And so, having, that little bit of vape to help you right when you wake up and, to tide you over until a tincture kicks in. That's
Right.
very common. And that's a really smart way to approach it.
Yeah, and they talk about medical marijuana for back and hip pain, back, hip, and arthritis pain. Again, a lot of the pain regimes that we talked about today, the products, the tinctures, they will all work for that. And again, it's a matter of, find your dosing routine, find your tolerance to THC, find out what products work, and more importantly, more than anything else, and what I was talking to Victoria about, she says she's using it, it's not working. A lot of it has to do with the terpene profile. If you don't have the right terpene profile, you can use cannabis all you want, it's not going to work. I've had people say to me, oh, I've tried it and it doesn't work. And I've looked at what they're using, and the terpene profile on the product doesn't match or doesn't help the relief that they're looking for with a particular lifestyle altering condition. So really, then that's where you need to talk to not only your dispensary, but talk to your doctor. He'll help you with that all right. It says, will you please cover RA? Well, rheumatoid arthritis, I think we've covered it a couple of times. And by the way, if you want, earlier this month, we did a rheumatoid arthritis webinar. So please go back to our website, check it out. You'll find all the webinars that are there. You'll find the webinar itself, as well as the slides that'll help you quite a bit with that. And hopefully we'll be able to cover that. Rheumatoid arthritis, high CBD, lower THC, get that inflammation down and you'll help quite a bit. Proper dosing for oil tinctures for back relief pain. Again, that's what I use. I use tinctures to be able to help me with my back relief. Again, in my case, it's not my back as much as my neck, but they do work. And again, I cannot tell you what dose to take. I think that's really important to point out. You have to find, everybody's body is different. Just like some people, as mentioned earlier, some people have a high tolerance to alcohol and caffeine. Same thing with medical cannabis. It's something that really you have to take a look at yourself. That's out there. So hopefully that helps quite a bit. These questions help quite a bit. Lee, I think we've covered all the questions. Is that right? Oh, wait a minute. Charles has a couple of.
We got a couple more.
Couple more, which is great. When it comes to blood issues, I have to tell you, please, you can use medical cannabis. It can help, but you really need to get your medical doctor and your cannabis doctor to work together to make sure that you get the prescription right. In other words, you make some alterations to the pharma drug, and as well as you have some alterations you make, or some types of products that you use in the medical cannabis side. People have used medical cannabis effectively, but I'm gonna not give you medical advice over the skip to this. Talk to your doctor, talk to your medical doctor. If you have a medical doctor that really isn't into medical cannabis, find one that is. Okay, you're finding more and more doctors today are understanding that cannabis can help, but I think it's something that, again, it's a matter of what the dosing is, and it's a matter of hitting the products right. Please, Charles, be safe. Talk to your doctors, and let's take the safe approaches here. Bill says there's no expiry date on the tinctures that I bought. That's interesting because a quality tincture should have an expiration date. Is that safe to say, Lisa?
Yeah, I would. I'm wondering if maybe it's hiding on the box it came in or something like that.
Yeah. It's on the bottle. Yeah, it should be. Yeah, it should be on the bottle, but yeah, you never know. Anyway, yeah. I would just be careful with it. That's all. So let's see. So we got to thank you for the advice on rheumatoid arthritis. Look, our goal here is if just one person gets their life back, if just one person gets it so that it helps quite a bit, then it really this webinar has been successful. We really are here to help you. Absolutely. And I think that's what's important. Dosing and getting the right terpene profiles. I cannot emphasize more that you take a look at both of those to make this all work. So I think we've covered almost all the questions. Oh, wait a minute. Hold on. We got some more. So let's dive into these.
But wait,
I love it. I have no problem with more questions. What's the best for severe osteoarthritis in hands and fingers? That goes back to the same thing as RA. You need to have a high CBD, low THC product. And again, find a product, test a few products, try a 1-to-1, It's 1 CBD to 1 THC. Try a 1 to 4, 1 CBD to 4. I'm sorry, 4 to 1, 4 CBD to 1 THC. Try the higher concentrations of CBD, but you have to have some THC that's in there. Some THC. If you're looking at a CBD-based product, what you want to do is you want to take a look at something that has what they call full spectrum. Now, I will tell you, I have developed over the last couple of weeks a problem with my finger, and I use a topical. In the evenings, I put a topical on because I tend to have most of that pain in the evening, and I found I put the topical with the tinctures really helps quite a bit, and you might want to take a look at that. What's the best medical marijuana combination for chronic pain and inflammation? Again, we've talked about that quite a bit. Really, it's a combination of high CBD, low THC. And if you have sub and joint replacements, I can relate to that. I've had 2 knee surgeries, 2 knee replacements, and that's no picnic. Now, on the I love to travel issue, be very, very careful. When you get to the airport and you go into TSA, that is federal space. Do not carry cannabis with you, because once you walk into federal space, TSA has actually come out and said they're not looking for cannabis products. That's not what they're looking for. But if you put a vape pen down there, you have a bottle, you have something that they find, they have to do something with it, and don't just stay away from it. My recommendation is find with the location that you're going to, find a dispensary. When you get there, buy your products while you're there, and it makes it a lot easier to be able to use the products that are there. There's a whole bunch of reasons, and people talk about how to use it while you travel and things like that. Safest and best advice is find out where you're going, find a dispensary, and be able to get the products that are there. Don't get yourself into trouble. There's no reason to get up close and personal with a lot of police, that's for sure. Best ratio for CBD and THC, I'm going to go back to dosing. It really depends on you. Your body will tell you what works. For me, I have a ratio that works for me, and I have other patients that have a completely different ratio, and it has to do with their metabolism, their body, and what's there. That's why dosing is really important. I can't give you a ratio. Your body will tell you your ratio. Pain, is THC better, or use both? I would use both. CBG is great, and there's no question that, and there's a lot of discussions now about CBG. Remember, CBG is what they call the mother cannabinoid. All the other cannabinoids come from CBG when the plant's basically growing. But I would use a CBD and a CBG for pain. I would use both. I think that's the best way that they handle it there. Anyway, it says, what terpenes contribute to bioavailability? Well, actually, it turns out that almost all of them do. It's interesting that there's an article that I have pulled up. In fact, I'll include it. I'll include it in the notes that are after this. There's a whole article in the National Institute of Health database on bioavailability of terpenes. And again, I'll just include it in the information that we send. But it's something that yes, it does contribute to the bioavailability, and it does help quite a bit. And again, I'll send you that information that's out there. We'll put it in the information that follows up. And this is a study from the National Institute of Health database that's out there. It says, I have been using medical marijuana 7 months now, 2 different, and have no relief. I want to know what I'm doing wrong. It's not a matter of wrong or right. I think it's a matter of making sure that you get the right terpene profile. This is where you need to say to your doctor, what terpenes should I be taking that's there? And by the way, if the doctor is having trouble answering that question, you can ask your dispensary. In many cases, the dispensaries may know the terpene profile. And then I will also say, stay tuned, because in a couple months, we'll be able to give you a product that will help you with that. But your problem isn't you. Your problem is you're probably picking up some products that don't have the right terpene profiles. I know that doing some of my research into terpenes, what I found out was there's a number of dispensaries that don't have any terpenes in their tinctures. And so you're buying a tincture product thinking that you're getting some terpenes, and they're not there. So you got to be really careful. You got to make sure that you're getting the right terpenes and that they're helping you. Your problem is just making sure you get the right terpene profile. And I hope that helps quite a bit.
Yeah, and
So
I would just
I
add
think,
that, cannabis is a journey, Don't think of it as something that you're doing wrong. You have successfully found 2 products that don't work for you. So that's success. That's not a failure. And so when you go to the dispensary and you talk about what is not working for you, that's just as important as what is working for you. And so, switch up that terpene profile, like Marc said, maybe switch up the cannabinoid content a little bit. And I think that that will help you out.
Right. Now, we have one last question that's not here. Yeah, so I thought you need a license from your state. If not, you can't buy it from another state. The answer is yes, and you have to have a license in each of the states that you purchase in. Now, there are reciprocations that's being done. I know I can use my license in California and other places, but Florida doesn't recognize anybody else's license. So the problem is, I don't know about Massachusetts, but I would say the unfortunate problem is to be able to buy medical cannabis in other states, unless they're a recreational state, you need to have that medical marijuana license. And again, that's one of those things that hopefully in the future legislatively will address to be able to do that. But unfortunately, we're in the prohibition stage right now. So there you go. So Lisa, we answered a lot of questions. I want to say for folks that are watching, first of all, thank you very much for taking the time. It's been a long webinar, but hopefully, as I mentioned, if just one person gets their life back by being able to use this, it's really there. And feel free to ask any questions you might have to event@marijuanaaware.com. Want to get a card, and what Charles was talking about giving a card because his wife has one, please go to marijuanaaware.com or MMTC of Florida. They'll help you quite a bit. And if you need medical cannabis, Insa, you can help. So Lisa, give me some of your wrap-up comments.
I would just say, cannabis is nothing to be afraid of. If you are looking to manage your pain with cannabis, start off with something that's a high CBD. Don't be afraid to talk to the retail associate or bud tender at your local dispensary and tell them your concerns, tell them your goals, tell them what you want to feel during what times, and they should be able to offer you a pretty good routine regimen. And again, it's a journey, so don't get discouraged if you try a product and it doesn't work. There's going to be many other products out there for you to try, and you may hit on that really successful one that really turns around your pain management on your next try. So don't give up.
Great. And I want to thank everybody for, first of all, Lisa, I want to thank you for helping me tonight. Great comments as usual. And it's always a pleasure to work with you. I want to thank everybody for tuning in tonight. I know it's been a rather long webinar, and I think it's important that we say thank you. And also tune in next week. We have our cancer webinar the week after neuropathy, and then anxiety and stress. So there's some good topics coming out. But I want to thank everybody for joining me tonight. I want to thank you for the time, and hopefully we'll see you in the future. So everybody stay safe, stay well, and again, we look forward to your questions.